Measles outbreak surge. U.S. sets modern record with 1,267 cases. Measles outbreak 2025. Record cases in the U.S. after 25 years of elimination. Measles outbreak surpasses 2,000 elimination mark in U.S. Measles outbreak surge. U.S. sets modern record with 1,267 cases. Hold onto your seats, America. We are just 8 measles cases away from breaking a terrifying modern-day record. And this surge isn't happening in a vacuum. It's part of a continental crisis that's exploding across the Americas at an alarming rate. Let me explain what's happening and why this should concern every one of us. The CDC just added 40 new measles cases this week, pushing the 2025 U.S. total to 1,267 infections. That's dangerously close to the 2019 record of 1,275 cases, the highest since measles was declared eliminated stateside in 2000. While the massive West Texas outbreak has slowed, smaller flare-ups keep multiplying. We now have 27 separate outbreaks nationwide, up from just 16 in all of 2024. Shockingly, 88% of this year's cases stem from these outbreak clusters. But here's where it gets controversial. Our neighbors are faring even worse. Canada's battling 3,170 cases, including 1 death, its worst outbreak since elimination in 1998. Mexico's fighting 2,597 infections with 9 tragic deaths. The Pan American Health Organization reports a jaw-dropping 29-fold increase in measles cases across the Americas compared to last year. The virus exploded in late April, heavily impacting vaccine-hesitant communities like Mennonite groups. Of those infected, 30% were unvaccinated while vaccination status remained unknown for 65%, a data gap that should terrify every epidemiologist. In a chilling development, Wyoming just confirmed its first measles case in 15 years, an unvaccinated child from Natrona County. Health officials warn this child briefly visited a Casper emergency room on June 24 to 25, potentially exposing others. Dr. Lexia Harris, Wyoming's top health expert, delivered this urgent reminder: measles is wildly contagious, but completely preventable. The MMR vaccine is 97% effective with 2 doses. Meanwhile, new cases keep emerging. Utah added 2 cases, total 9. Michigan reported a travel-related infection in a child, state total 17. Florida confirmed its 3rd case, a young adult exposed abroad. Kansas added 3 outbreak-linked cases, total 83. The real controversy. This isn't just about anti-vaxxers anymore, it's about how undervaccinated pockets anywhere become tinderboxes for outbreaks. When international travel meets declining immunization rates, this is the devastating result. What's your take? Should schools deny admission to unvaccinated kids during outbreaks? Do airlines bear responsibility for checking passengers' vaccine status? Sound off below, this debate affects us all. Measles outbreak 2025. Record cases in the U.S. after 25 years of elimination. We are facing a startling public health crisis. The United States is experiencing a measles outbreak of unprecedented scale, surpassing any recorded in the past 25 years since the disease was declared eliminated here. This isn't just a statistical anomaly, it's a direct consequence of declining vaccination rates and a particularly intense outbreak originating in West Texas, threatening to undo decades of progress. But here's where it gets controversial. The response and leadership surrounding this crisis are raising serious concerns among public health experts. As of mid-year 2025, a staggering 1,277 confirmed cases of measles have been reported across the nation, according to data from the Johns Hopkins University Center for Outbreak Response Innovation. This already exceeds the previous record of 1,274 cases set in 2019, and experts believe the actual number is significantly higher due to underreporting. Tragically, 3 deaths have already occurred: 2 young children in Texas and 1 adult in New Mexico, all individuals who were unvaccinated. This is the most measles deaths the U.S. has seen in over 2.5 decades. For context, elimination doesn't mean eradication. It signifies that measles is no longer continuously spreading within a population. This milestone, achieved in 2000 thanks to the development and widespread use of the measles mumps rubella (MMR) vaccine, first available in the 1970s, was hailed as a historic public health achievement by the Centers for Disease Control and Prevention, the CDC. Prior to this year's surge, the average annual number of measles cases in the U.S. was around 180. In 2019, outbreaks in New York, particularly within Orthodox Jewish communities in Brooklyn and Rockland County, highlighted the vulnerability of pockets with low vaccination rates and targeted by anti-vaccine misinformation. This year, the epicenter of the outbreak is West Texas, specifically Gaines County, where over 750 cases are linked to a single outbreak that began in late January. If this outbreak continues to expand, the U.S. could officially lose its measles elimination status. Nearly 1 in 4 kindergartners in Gaines County remained unvaccinated against measles during the 2024-25 school year, demonstrating a critical gap in protection. The outbreak's impact extends beyond West Texas, with dozens of cases reported in New Mexico and Oklahoma, and potential connections to cases in Kansas. Fortunately, public health officials are responding. Special vaccination clinics have been established, and many counties have broadened their vaccination guidelines, allowing infants as young as 6 months to receive their first MMR dose, the move previously delayed until 1 year of age. New Mexico, for example, has administered almost twice as many MMR vaccines this year compared to the same period last year. Recent data analysis by Truveta, a healthcare data and analytics company, reveals a significant increase in early vaccinations in Texas. Vaccination rates among 6-month-olds have surged, exceeding those of 2019 by more than 8 times, with roughly 1 in 5 infants receiving their first measles shot before their first birthday. However, while the West Texas outbreak has slowed, cases continue to emerge across the country, with at least 27 outbreaks, defined as 3 or more related cases, and 38 states reporting at least 1 case. Consider this: a single traveler unknowingly carrying measles boarded a flight in Colorado last month, triggering multiple cases among passengers and airport personnel, and ultimately leading to broader community spread. Further complicating the situation, some Colorado residents contracted measles after traveling to Chihuahua, Mexico, where a large outbreak is affecting the Mennonite population. A similar connection exists between an outbreak in Ontario, Canada, and cases in Michigan. Tragically, Canada and Mexico have also experienced measles-related fatalities, with 1 death in Canada and 9 in Mexico. Recognizing the escalating risk, Mexico issued a travel advisory in April, warning individuals traveling to the U.S. and Canada about the high rates of measles. The CDC has also reinforced its guidance for international travelers, strongly recommending 2 doses of the MMR vaccine. The vast majority of U.S. cases this year, over 92%, have occurred in unvaccinated individuals, while only about 8% have affected those who received 1 or 2 doses. Alarmingly, 155 measles patients have required hospitalization, and 28% of cases involve children under 5 years old. The MMR vaccine is remarkably safe and effective. A single dose prevents approximately 93% of measles infections, while 2 doses provide 97% protection. However, measles remains one of the most contagious diseases globally. The U.S. Department of Health and Human Services aims for at least 95% of children in kindergarten to receive 2 MMR doses, a crucial threshold for preventing outbreaks. Unfortunately, the U.S. has fallen short of this goal for 4 consecutive years. Data from the CDC reveals that a record number of U.S. kindergartners claimed exemptions from required vaccinations during the 2023-24 school year, leaving over 125,000 new school children without at least one state-mandated vaccine. This underscores the growing challenge of vaccine hesitancy and its potential consequences. Following the 2019 measles surge, the then HHS Secretary and CDC Director issued statements emphasizing the safety and effectiveness of the MMR vaccine and urging vaccination. However, the current situation presents a different landscape. The CDC remains without a director, and HHS Secretary Robert F. Kennedy Jr. has a complex and often critical history regarding measles vaccines. And this is the part most people miss. Kennedy recently dismissed a panel of vaccine advisors, a move that has deeply concerned public health officials. Dr. Bruce A. Scott, president of the American Medical Association, stated, with an ongoing measles outbreak and declining routine childhood vaccination rates, this move will further fuel the spread of vaccine-preventable illnesses. What do you think? Are current measures sufficient to address this escalating measles crisis? Do you believe the recent changes in leadership and advisory panels will hinder or help efforts to control the outbreak? Share your thoughts and concerns in the comments below. Let's discuss the challenges and potential solutions for protecting public health. Measles outbreak surpasses 2,000 elimination mark in U.S. Hold on to your hats. America is facing its largest measles threat since the disease was officially declared eradicated 25 years ago, and the numbers are downright alarming. As we hit the halfway mark in 2025, confirmed measles cases have skyrocketed to 1,277, already shattering 2019's previous record of 1,274 cases. This explosive resurgence isn't just a statistic, it's a public health emergency unfolding right now. According to real-time tracking from Johns Hopkins University's Center for Outbreak Response Innovation, this crisis stems primarily from a massive outbreak originating in West Texas, with additional cases spreading through community transmission and travel. The human cost: at least 155 hospitalizations, 431 adults, 824 children, and tragically, 3 confirmed deaths, including 2 school-aged children in Texas. But here's where it gets chilling. Measles is arguably the most contagious virus on Earth. Picture this: if an unvaccinated person is exposed, there's a 92% chance they'll contract it. Even more terrifying, 1 in 5 infected individuals requires hospitalization, according to CDC data. Now, you might be wondering, where is this hitting hardest? As of July 5, 39 states are reporting cases, but Texas is the undeniable epicenter, with 753 confirmed cases across 36 counties. New Mexico and Kansas are also seeing significant outbreaks. And this is the part most people miss: symptoms don't appear immediately. After exposure, it takes 7 to 14 days for warning signs to emerge. High fever, cough, runny nose, and watery eyes often come first. Then comes the infamous rash 3 to 5 days later, accompanied by dangerous fever spikes over 104 degrees Fahrenheit. Look for tiny white Koplik spots inside the mouth. These are telltale early indicators. So how do we stop this? Vaccination remains the absolute best defense against this preventable disease. Recognizing symptoms early is crucial for containing spread. But here's the controversial elephant in the room: How did we backslide so dramatically after elimination? And what does this say about vaccination trends in 2025? What's your take? Is this purely a healthcare failure, or does personal choice in vaccination play a bigger role than we admit? Drop your perspective in the comments below. Let's have a real conversation about protecting our communities. Measles outbreaks